You're watching Fox 10 AZAM.
There are a lot more options for women when it comes to giving birth these days. Natural births, epidurals, C-sections. Ahead, a look at the increase in expecting moms asking their doctors for a scheduled C-section. The reasons why and the risks involved.
It's becoming more and more common for expecting moms to plan a convenience birth, schedule a C-section, or induce labor.
Well, Liz is with a Valley OBGYN who has seen an increase in requests for scheduled C-sections and tells us 3 reasons why some women would request this. Hi, Liz.
Good morning, everyone. So get this, 1970, that's when women were having C-sections about 5% of the time. But now, about 1 in every 3 women, 1 in every 3 is having a C-section, if I can speak. So, hey, get on in here and look at this. So we have Ashley right here. She is pregnant very clearly with her 2nd child. Congratulations, Hunter, we're looking at here, right?
Yes.
Okay, and you are not having a C-section.
As of now, I'm not having a C-section.
And this is your 2nd child. And why did you decide that you wanted to opt out of that?
I just feel the recovery time is a lot longer, and with having a toddler at home, it makes it a lot more difficult trying to take care of the 2 babies together.
And Dr. Marchand, OBGYN here, I'm going to kind of squeeze in here. You have seen a rise in C-sections. Why do you think that is?
Yes, there's definitely a rise in cesarean sections. Some of that has to do with the decrease in vaginal birth after cesarean section, but a lot of that does have to do with primary elective cesarean section, or women wanting to choose when they have their baby, the date of the cesarean section, kind of a designer cesarean section, if you will.
Is that something you would recommend?
Well, I think as long as the patient understands the risks and the benefits, I'm not against it. I think a lot of women are apprehensive to have a baby vaginally. A lot of women think it may change their anatomy after having a baby vaginally, and not all of those concerns are rooted in good medical data.
So we were talking about a cesarean section and how there is a big recovery time because this is a major surgery here. Could you kind of show us what that kind of incision would look like? Do you want me to hold this?
Absolutely, I could put this down.
Okay. Yeah, you probably don't want to trust me with that.
Cesarean section scar is about 6 inches or 15 centimeters. Now, I'm going to draw this a little higher than I would normally put my C-section scar, but as you can see, it's about a 6-inch incision. So we are talking about a serious recovery and a small but significant risk of an intraoperative complication.
Okay, I see. Yeah, that's a big surgery, a really big incision there.
The benefit to a planned cesarean section or an elective primary cesarean section without indication is that you do avoid a labor process, and of course, there's always the chance that at the end of that labor process, you'd end up with a C-section anyway.
So there's no medical risk for the baby either way?
No, not to the baby per se, but it is a major abdominal surgery that you might have otherwise been able to avoid.
So we've had, I don't know how many, we were saying 3 reasons why there's been an increase. I think we've covered 2. What's another one? I know that we were talking about undocumented immigrants. They come in and that's something that you see. They are opting for the C-section more often. Why is that?
Well, I think that a lot of women do want the primary cesarean section, and there is a rise in people who want to combine a cesarean section procedure with a sterilization or tubal ligation procedure. And although it's probably not the best idea to force them to go together in an unnecessary cesarean section, I think a lot of people choose that option.
Because it's covered with the insurance that they're able to get?
That is correct.
Okay, interesting. Okay, so, I mean, that's your 3 reasons. You are seeing a rise. Now, how many, like, if you could put a number on it, how many women do you say come in and get the C-section and opt for it in a designer fashion?
Well, it's a low percentage, but it's certainly more than in years past. I do have quite a few patients coming to my office saying, you know, I'd like to have my C-section, and even at their first visit at my office saying, can we pick the date right now?
Okay, interesting. Anything else you think people need to know about this?
Well, I think it's important to know all your options, and I don't think it's totally wrong to go ahead and pick this option, but you should know all the risks and benefits because it is a serious abdominal surgery.
Talk to an OBGYN like yourself and make sure that you know what you're getting yourself into. Thank you so much for your time. Really appreciate it. Back to you guys.
All right, Liz, thank you.